Virtual International Scientific Conference 2020. We're going to start the parallel session 2. The theme of this session is Public Health, Education, Practice, and Law. This session will be chaired by Professor Dr. Nazmul Islam, Line Director and Manpower Development, Director General of Medical Education, Ministry of Health and Family Welfare, and also myself, Professor Dr. M. Humayun Kabir Talukdar, Professor of Curriculum Development and Evaluation at the Center for Medical Education, will be the co-chair of Professor Nazmul Islam. And in the meantime, I'm also doing the moderating of this session in absence of Dr. Arun Shai. When he will be joining with us, he will be taking over the charge of moderator. So now I'm requesting Professor M. Nazmul Islam to start the session formally. Please, sir.
Thank you very much, Professor Humayun Kabir. Very good morning. Thank you very much for joining us. We have participants all around the globe. Already we are lagging behind time. I would like to start the session. At first, I would like to request Dr. Muhammad Ashraful Alam, Assistant Director, Dhaka Medical College Hospital. He will present preventive health practices of rural adults in the new normal context of COVID-19 pandemic, application of structural equation modeling. I would like to request Dr. Muhammad Ashraful Alam to come and take the floor to present his paper. Dr. Muhammad Ashraful Alam.
Thank you, sir. Honorable chairs and dear listeners, good evening, everyone. I am Dr. Muhammad Ashraful Alam with my presentation on preventive health practices of rural adults in the new normal context of COVID-19 pandemic, application of structural equation modeling. Slide, okay. Like to mention my co-investigators in this study. First of all, Dr. Muhammad Najmul Haq, Brigadier General and Director, Dhaka Medical College Hospital, Dr. Halima Sultana, Dr. Shubhashi Shah, Dr. Yasmin Sultana, Dr. Afrin Ahmed Clara, and Dr. Sumaya Jabin Yusuf Jai. And the project was funded by Bangladesh Medical Research Council. COVID-19 is a global pandemic since March 2020. Before justify the study, I like to share a little bit about the timeline of COVID-19 global as well as Bangladesh journey. December 2019, Wuhan, China was the city of panic. Then 1st January, we saw that Wuhan wildlife market was closed. And March 8, Bangladesh reported its first 3 cases. And then we saw the non-stop COVID journey across the country. At the end of July, Bangladesh had less than 250,000 cases. But the end of the first week of December, Bangladesh reported 481,945 confirmed cases and almost 7,000 deaths. Prevention is the best defense against the novel coronavirus until getting a specific treatment or vaccine. And we are mostly familiar with 3 preventive health measures: using face mask regularly, hand washing with soap, water, or sanitizer. And we heard so many words about social distancing. That means physical gaps. Actually, social distancing and using face mask in gathering had been routinely practiced during the pandemic, even in developed countries like USA. And regular hand washing with soap water are hardly familiar in third world countries like Bangladesh. And we saw that South Asia is the hotspot for COVID-19 along with USA, Europe, and Latin America for many months. Bangladesh is highly vulnerable considering its demographic characteristics. And the problem is, and it's more problematic in rural areas due to its widespread illiteracy and poverty. And we know that rural adults are more vulnerable to COVID from its beginning. Although behavioral change is important in such pandemic crisis, but unluckily, behavioral issues are neglected in third world countries. COVID-19 impacts both on health and economy, and third world countries like Bangladesh cannot continue like lockdown a long time to save its economy. People across the country have to adopt the preventive behaviors to control the rapid spread of coronavirus as well as to save their lives. People as well as planners are mostly worried about testing and clinical management, but initiatives or innovations on behavioral changes are almost unseen. The study was conducted to describe COVID-19 prevention behavior through structural equation modeling based on reasoned action approach. Now I'd like to share a little bit about methods and materials. The study was actually mixed method approach, mixed method survey, but this presentation actually based on only the quantitative data for structural equation modeling. Don't like to focus more on socioeconomic issues for time limitations. After describing latent variables, like to give emphasis on the models. We can see here the latent variables are practice, knowledge, attitude, motivation, intention. These are the 5 important latent variables in the structural equation model. And we can see that almost half of the rural adults showed poor COVID-19 prevention behavior, and poor knowledge and attitude regarding COVID-19 prevention are also common scenarios in rural areas. Majority of the rural adults were not well motivated, and lack of seriousness made them more vulnerable for COVID-19. Then we go for the hierarchical regression to predict the important variables or predictors. Among the background issues, we can see that gender, age, monthly family income, educational level, marital status, and regional variation were significant. Some of them highly significant, and marital status was just significant. And after including the other latent variables like knowledge, attitude, motivation, intention in the second model, we can see all the variables are here significant. After that, identifying the confirmatory factor analysis to go for the structural equation modeling. These are actually the model, and it was based on the reasoned action approach. According to the reasoned action approach, we know that attitude and motivation influences behavior through intention. So here the 3 blocks, we can see the first block, the attitude and motivation, and the second block is the intention, and finally the third block is the behavior. And we can see here the attitude and motivation influences behavior through intention. And this attitude was based on the 3 indicators, motivation has also 3 indicators, intention was assessed on the 4 indicators, and behavior was described based on the 3 indicators. And if we look at the model, it is the initial model. The attitude, attitude significantly influenced the intention, and we can see the beta is the 0.81, and motivation also influenced intention with beta 0.15, and intention influenced behavior with beta 0.88, and all the indicators, goodness of fit indicators, were good enough to justify this initial model. But we had little chance to improve this model, the initial model. We know the knowledge is an important issue in behavior. After that, we just added knowledge in this reasoned action approach as a third exogenous latent variable. We can see the first one is the knowledge, then attitude, and then motivation. And here we can also find that knowledge influences intention with beta 0.50, and attitude influences intention. Motivation also influences intention, and finally, intention was highly significant to predict behavior. We can find the significant results here actually. If we see the table, all the indicators, not only the among the latent variables, we can see all the indicators with the individual latent variables are highly significant to describe the model. Like we can see the p-values of this model, like between attitude and intention, motivation and intention, knowledge and intention behavior, knowledge. These are the main latent variables, and below these all are the indicators like opinion on severity, opinion on prevention. These are the indicators of attitude. Similarly, family influence, community influence, or organizational influence. These are the indicators of motivation. We can find here not only among the latent variables, but also within the latent variables, all the indicators are highly significant to describe the adjusted model. Finally, we can conclude with few recommendations. Then COVID-19 prevention behavior of rural adults was not satisfactory, and majority of them were reluctant and irregular to use face masks and maintain social distancing. And men were more vulnerable with their poor health practices. The consistency of the health practices was another public health concern during the pandemic period. Although lockdown was not expected to most of the rural people, but they were more disciplined to follow the health rules during the lockdown time. Not only individual issues, but also community as well as organizational limitations were responsible for their poor health practices. And COVID-19 prevention behavior based on this reasoned action approach model has theoretical evidence that will be beneficial for other researchers at home or abroad. It's easy to now take interventions or innovations based on these findings, and we can use this model. The findings will help to prioritize the intervention areas to improve health practices of rural adults regarding COVID-19 prevention. Ministry of Health and Family Welfare should give more focus on health awareness program in rural areas regarding COVID-19 prevention. We have already seen so many crises in testing and clinical management, but we hardly see, so far we hardly saw the awareness program, focus on awareness program. And mass media can be utilized with more emphasis on COVID-19 prevention. Finally, social support should be ensured in this crisis. And actually, this is from my side. Thank you all.
Thank you very much, Dr. Muhammad Ashraful Alam, for your beautiful presentation. Now the floor is open for question and answer. Anyone can ask questions to Dr. Muhammad Ashraful Alam. The floor is open. If you do not have any question, then we can proceed to the next presentation. Ladies and gentlemen, I would like to request Professor Dr. Muhammad Anwarul Azim Majumdar to present online learning readiness of medical and allied health professional students during COVID-19 pandemic, a multi-country study. Professor Azim.
Okay, thanks, Chair. I think in the schedule there was it was Dr. Bidya, second presenter. So should I proceed?
Oh, sure, please.
Let me share my presentation. Can you see the presentation?
Yes.
Okay, so my presentation title is Online Learning Readiness, of medical and allied health professional students during COVID-19 pandemic, a multi-country study. So the study is conducted by Faculty of Medical Science Cross-Campus Study Group, the University of the West Indies. So first of all, I'll give some background about the University of the West Indies. The university is ranked number 1 in the Caribbean, among the Caribbean universities. It is included in the top 3% in the Latin American Caribbean universities, and also including the top 5% of the world universities. And 2020, it was ranked among 100 global universities. So it was established in 1948, and it was one of the oldest and longest standing university in the region. And currently there are over 50,000 students, 9,000 graduates annually, and more than 120,000 alumni. The university is based in 4 campuses in 4 countries: Antigua, Barbuda, Barbados, Jamaica, Trinidad and Tobago. It has 1 open campus serving 17 nations in the region. It offers over 800 certificate, diploma, and degrees. So this is the aerial view of one of the campuses. It's a Cavil campus, Barbados, where I am based. You can see the the university cricket ground, and on the left there's a university residence for the student, and on the left, on the right, there's all the faculties, including Faculty of Medical Sciences. So now comes to COVID-19. As you know that COVID-19 has produced rapid and dramatic changes in medical education worldwide. All the countries are affected, all the medical schools are affected, and everybody is affected. And the pandemic forced medical schools to stop face-to-face learning and shift to online delivery of teaching and assessment. Clinical placement training was suspended. So here in the University of West Indies and Faculty of Medical Sciences decided to conduct online teaching while students are off campus. So this is the very beginning of March when the COVID was detected and lockdown was implemented. So we decided to start online teaching and assess our students remotely. And we used guidelines to plan alternative online learning and assessment. This is one of the integrity of the approaches taken for assessment and learning, equity among the students, fairness, ethics, and preservation of the regionality. While doing so, the FMS, the Faculty of Medical Sciences, encountered several academic, technological, and administrative challenges. So to identify the challenges, we are asked to conduct a study which aimed at to assess medical and allied health professionals students' readiness for online learning and assessment, including their access to technology during COVID-19 pandemic. So the study population included medical students and allied health professional students, and the study placed 4 sites of Faculty of Medical Sciences in 4 countries: Barbados, Trinidad and Tobago, Bahamas, and Jamaica. We used 2 questionnaires, and we used online survey using SurveyMonkey during April to May 2020. So results, we found the total respondent were 1,500 students, and majority were from female MBBS program, year 1 students, and students aged between 21 to 23 years. And majority were from 2 campuses, San Agustin campus is from Trinidad and Tobago, and Mona campus from Jamaica. And at the time of the survey, almost half of the respondents were residing in Trinidad and Tobago. So when we asked about the technological preparedness, students mentioned that 92% students mentioned that they had a laptop, 46% had Android smartphones, 97% had access to Wi-Fi at home, 64% indicated that internet access was reliable and stable, 59% reported that they were confident with the online learning and assessment at the time of the study, and 66% had a suitable space for taking an online exam at home. So all these findings help us to develop our online learning at the very beginning of the pandemic. When we ask about the perception of students' perception of online learning and assessment, majority express their confidence with online learning and assessment. However, only 1/3 found online teaching more productive than face-to-face teaching. Maybe this is the early pandemic, students are not ready or they have less experience about the online teaching. And 90% express their concerns that online assessment might be disrupted by poor internet or power failure. We asked their preferences, the mode of assessment. 3/4 preferred asynchronous exam, 92% preferred exam with MCQ, EMQs, SCQs, and 43% preferred afternoon exams. More than half of the students recommended that more online examinations should be part of the curricula even after pandemic is over. We asked students about the experiences of online teaching and assessment before the COVID pandemic. Majority reported occasional or frequent experiences with online teaching and learning. Majority reported occasional or less frequent experience with online assessment and assignments. So this is a graphical representation. The yellow one is the online teaching and learning, and they have a occasional or often experiences. And the assessment assignment, the green and the pink, they have a rarely and occasionally they have experienced the assessment or assignments. But if you go on the right side at the extreme, it shows that they have a less or limited experience about assessment and assignments, online assessment and assignments. So conclusion, majority had a laptop and access to Wi-Fi at home. That was encouraging for us. Majority had occasional experience with online learning and assessment before COVID-19 pandemic, because we use the Moodle and other platforms to provide blended learning almost in all our courses. So majority expressed their confidence with online learning and assessment. However, there are concerns. Majority expressed their concern that online assessment might be disrupted by poor internet and power failure, and that was true. And I will mention that one in one of my other presentation. So, and majority preferred asynchronous exams with MCQs, EMQs, SCQs. So recommendation, as you all know that technology is the paramount. We have to use the technology to provide medical education, even maybe post-COVID era. So is the technology paramount, medical educators and policymakers. And one of our chair is, one of the key policymakers in Bangladesh. So they have to mobilize the resources to improve the quality of medical education. Resources is paramount. You have to invest for technology if you want to survive during COVID and post-COVID period. in relation to medical education. So more online learning and assessment should be part of curricula. Curricula should be reviewed and we would find out the alternative assessment and the effective learning strategy. This is during pandemic and the post-pandemic period. And the policymakers should be guided by the guidelines recommended by the national and international organization how to run medical education during COVID and post-COVID period. Our research was funded by Campus Research Award, the University of the West Indies, Cable Campus, Barbados. And these are some of our references we used for our presentation. Thank you. I'm ready to take any questions or any comments.
Thank you, Professor Majumdar, for your beautiful presentation. Now floor is open for question and answer. Any question? Okay. As we are running out of time, I would like to request the presenters, please maintain your stipulated time so that we can have a better discussion in between. I would like to request Mr. Bidyadhar, he will come with yoga, a panacea for managing stress among medical and allied health professional students during COVID-19 pandemic. Mr. Bidyadhar, please.
Hello, and can you hear me, everybody?
Yeah, sure. Loud and clear.
Yeah. Okay, the screen is visible?
Yeah, screen is fine.
Hi. So thank you very much, Mr. Chair, for facilitating this session. So the title of the paper is Yoga, a panacea for managing stress among medical and allied health personnel students during COVID-19. So with that title, we are moving forward, and basically, as you know, it is a matter of no secret that COVID has affected all segments of the society, and because of that, you can see that students are getting so much of stress, anxiety, and most vulnerable population in this situation are the allied health professionals and medical professional students. And it has been also proved that medical and allied health professional schools doing their best to elevate the stress and to improve the quality of life of medical and allied health professional students in their respective institute. So in all these exercises, yoga have been proved to be very successful in beating the stress. And numerous studies have found about the effectiveness of yoga mental health in improving the quality of life. And as most of the panelists here, audience here must be knowing that yoga started thousands years back in Indus Valley and Saraswati civilizations. But now it is gaining more popularity in Western countries, and more research is being conducted on yoga and its effectiveness. So basically the aim of this study was to find the physical effect of yoga on stress management, particularly the medical and allied health professionals during this particular time of COVID-19. So we adopted a narrative approach to conduct this review paper. You search the related terms like pandemic, COVID-19, yoga, mental stress, anxiety through the different sources, PubMed, Index, Scopus, and Google. Also, we bring the experiences that what we had in the Faculty of Medical Science, University of West Indies. As you know that pre-COVID-19 pandemic demonstrated that medical students already as a community, they experience higher level of stress and anxiety and depression. It has been reported widely. This is the medical and health professional students. And it has been also proved that yoga has been effective in reducing the stress and improving the quality of the life and psychosocial well-being of the students. Many studies, many reviews have established that fact that yoga is a very effective way, as well as what we call mindfulness also is a very effective way to improve the stress and anxiety. Because of the COVID-19, you can see the closure of educational institutions, interruption of learning, exam cancels, career at stake, all those things are happening. And particularly, it is very peculiar for the medical students because medical science or allied health professional is an area where we need face-to-face. But now the implementation of social distancing is keeping that happening. So because of that, non-supportive home environment will get social distancing, unfamiliar with different sorts of teaching, learning, examinations, uncertainties, all these results in stress and anxiety among this particular students community. Even if it has been one of the survey conducted among these US universities found that of undergraduate students screen for depressive disorder, while 32% of them having anxiety. So you can see how this COVID-19 has created a situation where all these stress and anxiety going through the students. Now, it has been proved that COVID-19 and psychology cite few selected research that when you say, particularly in China, one study was conducted by Lee, and they say that COVID-related symptoms of psychological distress are very much common among medical and nursing students. Again, all over the world, the study we have cited, citing from Iran, anxiety were more prevalent. All these studies are post-COVID-19. Another study conducted in UK among the medical students, significant impact on students and particularly affecting the transition from students to doctor. Another study from China and the South Korea also reported the same. There is the stress level and the anxiety very much prevalent among the students. Now, when we see this, we have to find out, we cannot see it like that because we have to provide the pastoral care to our students. So keeping that thing in mind, many institutes, they implemented yoga. They try to intervene the situation with implementation of yoga. And that way they will the psychological well-being of the students. The practice of inner engineering offered by ISA Research Center. ISA is a research center very much specialized in different types of yoga. And they have found that there is a 50% reduction in the stress among the participants. And this study was conducted in Harvard Medical School. Again, combined study was conducted here Massachusetts Institute of Technology, Harvard University, and University of California, San Diego. And they also found that yoga postures and breathing has very much effective in preventing the infection as well as bringing peace to the mind. So at the UE, our experience is what we try to student support services to both students and staff community, and particularly UE in collaboration with Harvard University organize a 7 weeks of yoga session that will, with regard to the mental health, and students were very much involved in this exercise, and students were asked to express their concern during academic advising. So concern raised during staff students liaison committee. So these are the different platforms they get to share their different sorts of experiences like stress or anxiety going through, so that we can provide the necessary support. Now, coming to that yoga particularly, as you know, yoga is recognized as an integrated science in global health sector, especially in medical educations, and has been integrated into different medical as well as allied health professions such as nursing and dentistry. The examples are here in the University of Pennsylvania, Mayo Clinic, Mahatma Gandhi Medical College, Kasturba Medical College in India, Indira Gandhi Medical College, Dental College in India. So all these colleges, they have integrated the yoga different undergraduate programs. So finally, I would like to conclude that yoga has promotive, preventive, and curative potential and has become widely accepted as a safe modality for stress management and improving the quality of life. In response to COVID-19, the use of yoga for the stress reductions and immune modulation should be considered as a complement to other treatment. And there is a need to integrate yoga into the medical curricula to prepare physically fit and mentally sound professionals. And we, as the medical school, as a medical professional, we also need to encourage more empirical studies to be conducted to find the effectiveness of yoga among the students. With that, I conclude. These are the references, and thank you very much. Any comments and questions are in?
Thank you very much for your nice presentation. Now the floor is open. In the meantime, Professor Humayun, I think Dr. Arun Shahi has joined us. Actually, he is the moderator of this session. Hello, Arun. Do you hear me?
Good evening, sir.
Good evening. How are you?
Good, very good, sir.
We are missing you. Please go as per schedule. Now you please moderate the session. Professor Humayun will come into the role of the chairperson. Professor Humayun.
So sincere apology for technical problems.
Okay. Yeah. Don't worry.
So today, today is a Public Health Foundation Day and Virtually International Conference 2020. And today's guest chair is Professor Muhammad Nazmul Islam, sir, Line Director and HMD, Director General, Medical Education, Ministry of Health and Family Welfare, Bangladesh. And we have another very distinguished chair of the session, Professor Humayun Kabir Talukdar, Head Medical Education and Curriculum Development, CME. So I would like to welcome both the chairs, and we will continue. So we have the third speaker.
No, speaker number 4.
Speaker number 4.
Yeah. Nabonita Bonik.
Nabonita Bonik, please.
Yeah.
The floor is yours. Nabonita Bonik.
Yes, sir.
Go ahead. Now floor is open. Now the floor is for you. Please go ahead. Nabonita will present a contextual analysis of existing principles of public health laws in Bangladesh and its approach to contain the spread of novel coronavirus. Thank you, Nabonita. Thank you. Please start.
Yes, sir. Starting. Good evening, respected session chairpersons, panelists, and attendees. I am Nabonita Bonik, undergraduate student from Department of Maritime Law and Policy at Bangabandhu Sheikh Mujibur Rahman Maritime University, and my co-author is Arifur Islam Rajiv, who is also from the same department. The title of our research paper is a contextual analysis of existing principles of public health laws in Bangladesh and its approach to contain novel coronavirus. The outline of this presentation is divided into following categories: background, rationale, aims and objectives, methods, literature review, secondary data collection, key results, why current laws are not working effectively, conclusion and recommendation. First, I will talk about the background of this research. As we all know, COVID-19 has become a global pandemic. Coronavirus, a single structured RNA virus, causes mild to severe respiratory illness. It was first identified in one province of China, created outbreak all over the world lately. This outbreak has been addressed as a pandemic by the World Health Organization. After the first case was found on 8 March 2020, the Ministry of Health and Family Welfare of Bangladesh has categorized it as an infectious disease and proclaimed a national health emergency. As coronavirus is a community transmitted disease, it certainly affects the public health sector of Bangladesh. Public health is an empiric and multidisciplinary field whose goal is to assure conditions in which people can be healthy. And public health law is a form of public health policy that integrates medicine, health care, and public health. Rationale. Law has emerged as a beacon of hope when science is lost, stunned, and the whole world is at a standstill after being defeated by this unknown nanometer-length virus. Like other countries, Bangladesh is not free from its effects. Due to the geographical location and structure, the density of population, and the socio-economic factors of people who belongs to the below poverty line, it's very tough to maintain proper lockdown and social distancing rules. Laws, rules, and regulations control the external behavior of human beings, but not to make them enslaved or captivated by law. Law works for the greater welfare of human beings. Till now, medical science couldn't provide 100% effective medicines. So in these critical situations, analyzing, upgrading, and enforcing laws in a proper strategical way can mitigate COVID risks to save both the country and its citizens. That's the main reason why we wanted to conduct this research. Aims and objectives. Our study is based on three main objectives. The first one is to identify current public health challenges in Bangladesh amid COVID-19, to analyze different public health laws of Bangladesh and its effectiveness on tackling, and the third one is to suggest some proposals to overcome current public health sector crisis. For conducting this research, we have followed certain methods. The sequence of the method is shown in these slides, which are literature review, secondary data collection, data analysis, proposals, and viewpoints. The first step was literature review. For this section, we reviewed the Constitution of Bangladesh, Article 15, 16, and 18, the Public Health Ordinance 1944, the Epidemic Diseases Act 1897, National Health Policy 2011, and the Infectious Diseases Act 2018. Then we collected secondary data from news articles, published academic papers, governmental documents and records, books, journals, and websites, academic experts. Though we initiated to collect primary data, we couldn't do so because of social distancing safety measures directed by government and overcrowded situations of hospitals with COVID patients. Key results. Major findings of our research are limitation of healthcare system, overcrowded public hospitals, infrastructural limitation, inadequacy of skilled machinery and laboratories, lack of skilled manpower and long-term planning, insufficient proper medical resources. Other vaccination processes is on hold due to COVID-19. Mental health of mass people is deteriorated due to quarantine and stay-at-home orders. Inadequacy of COVID-19 testing facilities. Need for a considerable amount of funds. Now let's have a look why current laws are not working effectively. What could be the possible reasons behind this? From our study of the situation, we found certain factors. One of the main reasons is the density of population. The population density of Bangladesh amounts to 1,200 people per square kilometer. It's quite impossible to maintain proper social distancing rules prescribed by World Health Organization. Then there is inadequacy of relevant provisions in our legal system. As this pandemic situation is new for everyone in this country, no prior laws have not been developed by the lawmakers. Also, absence of proper lockdown rules and insufficient safety measures are also worsening the situations. According to a report done by Al Jazeera, 1 in every 5 people living below the poverty line in Bangladesh, and that's why to earn their livelihood, they couldn't afford to maintain social distancing and lockdown rules. Last but not the least, no proper punishment for law violators is also responsible for this ineffectiveness. Conclusion. Right to health has been stated as a fundamental principle of state policy by the Constitution of Bangladesh, and the government of Bangladesh has introduced various initiatives to contain the spread of COVID-19. But there is still much more constraints to achieve proper public health safety that the government and public health officials are needed to be concerned about. In December, after 9 months of first COVID case found in Bangladesh, there are 4,75,789 cases, which makes Bangladesh the third among the South Asian countries. That's why to control the pandemic situation and for the welfare of the citizens, current public health crisis must be analyzed thoroughly, and amendments of current laws should be established accordingly. After analyzing the COVID-19 situations and its relation with the public health sectors of Bangladesh, we are providing some recommendations which can also be taken into consideration to improve current public health laws. And they are enactment of new legislation to deal with pandemic diseases, amendment of current provisions of existing laws following global standard, rule of law and natural justice should be established for ensuring equitable healthcare rights for all, proper enforcement and implementation of laws, making laws more accessible for all, reformation of public health policies, introducing rigorous preventive punishment for law offenders, and modernization of current public health laws. And that's bring us to the end of this presentation. Thank you all for your kind attentions.
Thank you, Nabunita, for your beautiful presentation. Now the floor is open for question and answer. I think there is no question right now. We can proceed to the next item. I would like to request Professor Humayun Kabir Talukdar to chair the remaining part of the session and his concluding remarks. To you, Arun. Thank you very much.
Thank you, sir. It was very nice to have you here. And Professor Humayun Kabir Talukdar, sir, now you can chair the session.
Thank you very much, Dr. Arun Shai and Professor Nazmul Islam. So I think we have remaining two presenters. Let us hear Jannatul Firdaus Tuli on her topics, online medical education in Bangladesh during COVID-19 pandemic, a medical student's perspective. So I'm requesting Jannatul Firdaus Tuli for her presentation.
There.
Is he absent? Yeah.
No, she's there, but I think you have to unmute. Please unmute yourself.
Oh, sorry, sir. Okay, thank you, sir. Assalamu alaikum, everyone. I'm Jannatul Firdaus Tuli from Dhaka Medical College. And on behalf of my team members, Kaushik Mojumdar from Chittagong Medical College and KM Shaila Sharmin from Mymensingh Medical College, today I'll be presenting in front of you online medical education in Bangladesh during COVID-19 pandemic, a medical student's perspective. So I will start with a little background and rationale of our study. and that is World Health Organization has declared COVID-19 as a global pandemic in March 2020. All the educational institution has been closed down since 17th March 2020 in Bangladesh to avoid the rapid spread of the virus. As medical students are more potentially vulnerable to the infection during clinical sessions, the traditional method of teaching has been suspended since then along with other educational institutions. And respective medical colleges and their authorities have started taking classes online without any prior preparation of the students or the teachers. So this sudden shift from the traditional method of teaching to the online classes has created some issues that need to be solved soon. And being a paradigm shift, online education has created commotions among the teachers and students. So our study aims to depict the actual scenario of the online medical education at the undergraduate level in Bangladesh. We have conducted a cross-sectional descriptive study during September 2020. We have used a accompanying type of non-probability sampling with a sample size of 431 undergraduate medical students. Among them, 283 participants were female and 148 participants were male. And all the students who have participated in our survey, they are currently attending the online medical classes under their respective medical colleges. And after that, we have used a pre-tested self-administered online question to assess the effectiveness of the online learning. And we have also conducted a pilot test of our survey, which was administered to a group of medical students online. And after they have gone through the pilot test and they have made their suggestions to our questionnaire, we have made the required modifications and revisions to our questionnaire, and then we have conducted our main study. And after we have conducted our study, the data we have got, we have analyzed that using SPSS version 26, using the frequency of the common students' responses, and that were stated in percentages. So after analyzing our data, we have got some key results. The participants from the public medical colleges were 69.8%, and that from private medical colleges were 31.2%. And among them, 19.3% students live in various villages of Bangladesh. And among these students, 73% students face different network problems while their online classes going on. And during these online classes, 60.1% participants find it very difficult to concentrate to their classes. And online class expenditure is hard to manage for 28.3% students who have participated in our study. 56.2% students from the private and only 25.6% public medical college participants are being assessed online on a regular basis. And after the pandemic ends, 37.1% participants want the online educational media for theoretical learning along with the traditional classes. And analyzing our data, we have reached some conclusions and recommendations. So our study suggests that the problems like the network unavailability in remote areas, then expenditure management for students of low socioeconomic condition, and taking online assessment regularly should be addressed to make an online education more effective. So that's all from my side. Thank you, everyone.
Thank you, Jannatul Firdaus. Do you have any question from anybody? To her? Quick question to Jannatul Firdaus. I think there is no question. If not, then we can request the last person of this session, Umagor, from Senior Lecturer in Anatomy from the Faculty of Medical Science, University of West Indies, on challenges of preclinical teaching during COVID-19, putting the best foot forward. I think, Umagor, please.
Thank you, Chair, Professor Moinkul Talukdar. Unfortunately, Dr. Gaur is sick, and I'm going to present on behalf of her. Is it okay?
Okay. Thank you. You can proceed on.
Yeah, I already informed the Mr. Rabbani, so I got the.
Most welcome. No problem.
Okay, let me share my screen. Okay, can you see and can you hear me? Hello.
Yes, yes, we can hear you. You're very clear,
Okay.
very audible. Please.
And can you see my
Yeah,
slides?
we can see your slide as well. Please.
Okay,
continue.
thank you very much. Okay, so the title is The Challenges of Preclinical Teaching During COVID-19, Putting the Best Foot Forward. Okay, so we are a group of researchers from Faculty of Medical Sciences, the University of the West Indies. As you know that, and it was discussed in previous presentation, so there's a disruption of in medical education worldwide, and especially in the preclinical phase. And due to the lockdown and social distancing, the student has limited access to lectures, limited or no access to lectures, practical labs, and clinical sessions. And all this online and remote teaching actually deprived students for hands-on experience, which is the core element of medical training. And one of the worrying things is that online learning, the technological challenges, social distancing, lockdown, non-supportive home environment, loneliness, unfamiliar examination formats, all created barriers to learning and also increase the stress and anxiety among students and even among the faculty members. So the objective of our study is to examine the challenges faced and the strategies adopted by medical schools to implement online preclinical teaching and assessment during COVID-19 crisis. So we did the literature review, and also we'll also present our experiences from medical schools in the Caribbean region. So literature shows that the medical schools worldwide have successfully moved to online educational environment, and this is very emergency. Some medical schools they started within the weeks of appearance of first COVID or detection of COVID cases in their country. So it was a new culture, a novel culture of online home-based learning, and with the use of technology-oriented innovations. Some specialties, especially preclinical, anatomy, lab teaching, or dissection was adjusted to online modalities. So the dynamics of the medical education was totally changed. What was before face-to-face teaching and what was after the pandemic, all online. So no on-campus teaching, all teaching assessment moved to remote and online. But there were lots of challenges. So we found from the literature that lack of reliable network infrastructure, compatible online platforms to support or link existing learning management system for the medical schools, shortage of competent IT personnel, because they are required to support student and faculty. Increased cost, as my previous presenter, Jannatul Firdaus, mentioned that the cost is one of the important factor. Schools lots of technology, IT support, students to buy computer and other devices also for the faculty. Poor computer technical skills of faculty and students. Inadequate infrastructure and resources, especially in developing world in resource poor settings. Also, absence of institutional policies, how to run online learning and the assessment. So sudden transition, it was a really challenging task, and it also affected the performance of the students and faculty initially. And moreover, and student had no access to dissection rooms, practical labs, and also clinical sessions. And limited students' exposure to anatomy and other important foundation subjects, which are core component of medical education. So now I will present the Faculty of Medical Science, the University of the West Indies experiences. So UE is the region's premier tertiary education institution, was established in 1948. It has physical campuses in Jamaica, Trinidad, Tobago, Barbados, Antigua with almost 50,000 students. And the Faculty of Medical Sciences is a unique, it's based on four countries. So this is unique in the, I think this is the first and last one in the world to have their campuses in 4 independent countries, one in Barbados, one in Jamaica, one is Trinidad and Tobago, and Bahamas. And it has an enrollment of 3,000 medical students in its 5-year MBBS program. So first, we did a survey to collect the baseline data.
Azim sir, you have 2 minutes left.
Students. Hello?
2 minutes.
Hello? Hello?
You have 2 minutes. Yeah, we can please continue.
Okay, so technology of online learning readiness, technology of preparedness, level of anxiety and stress coping strategy, social accounting and clear career choices. And then FMS transition to online mode and suspended clinical duties. All assessment, inclusive of final MBBS examinations, were administered remotely and unproctored. We had 550 students, final students, they became graduates on time during June, July 2020. So lab-based instruction are fully administered remotely using YouTube videos, photographs, and a commercial software called McGraw-Hill Virtual Lab. And large group teaching conducted through innovative ways. And we use the virtual clickers and Socrative app. So this increased the student attendance and participation. We also use the high flex teaching model to overcome the problems of lockdown and social distancing. It has numerous modality. Students have the options to have face-to-face live attendance, or they can attend live, online live streaming. They can off campus, they can attend, and then online asynchronous. I will explain next slides. So face-to-face is live, online live stream, watch class live streamed online, and the online asynchronous, students will be watching the posted recording of class session online at their own time. So this is the figure. You find that the teacher is here and the students are sitting in the class. Also student in the online, maybe Zoom. And if you say behind, students are accessing the recordings of the lectures and other teaching sessions on their own time. So this is a high flex model we used. So challenges. So internet connectivity issues is a real challenge. And some faculty also experience limitation with accessibility of appropriate devices, webcam, microphones. Faculty who never use the online portal, they have some problem, but it's a learning curve. But inappropriateness of the virtual platform to teach practical or clinical skills. And students are reluctant to show their face or talk. So this is the one of the limitation. And I mentioned the technology challenges. So yesterday, our semester 2 university exam started. It was the first exam. So midway between the exam, there is a island-wide, not island, it's a regional disruption in internet services. There was some problem with the I think cables in the undersea. So there's a damage. So we have to stop the hundreds of examinations throughout the region. So there is no exam for yesterday and for today. So this is a real challenge we encountered, yesterday, and it was really new for us, and we have to take, immediate action. So online learning has been expanding as a relatively new concept in medical education. And there's a lots of implication challenges for the educators, policymakers, increased responsibility, new teaching styles, continuous curriculum planning, alternate assessment strategy, effective communication, and the online learning and technological preparedness. So the technology is paramount. Artificial intelligence, simulation, simulation,
I think your time is off. Now you have to finish it in 15 seconds.
Okay, so this is the references we used. Okay, thank you very much. Any questions or any comments, please?
Like there is no question.
Thank you.
Please, sir.
Thank you very much, Professor Anwarul Azim Majumdar. I think we have completed the presentation and we are at the end of this our session. Before the formal closing by the moderator, let us just look back to the whole presentation within a very short time. The first presentation, to see the senior citizen or the geriatric population is a big challenge, is a concern all over the world. And the study conducted by the Muhammad Ashraful Alam, using the reasoned action approach and applying the structural equation modeling, is a proven solution for preventive health practices by the rural adult population. Thank you, Dr. Muhammad Ashraful Alam. You see, the health is a state of physical, mental, and social well-being. So if we consider the health, if we talk about the health, obviously we should think for the mental health. And due to the COVID situation, it was really drastically distorted. And the study conducted by Shah, the intervention given
I think we have lost Dr.
Yeah, I think now I am again, yeah. So yoga, so WHO also recommended physical exercise within this COVID situation time. So your study was really a good intervention to reduce the mental stress and depression. Thank you, Dr. Shah. The COVID has separated the learners from the real campus, and it was a pain for the learners, for the students all over the world. And the online teaching learning could connect the learners with the campus. The study conducted by Professor Dr. Anwarul Azim Majumdar was really very excellent on the online teaching learning in this COVID pandemic situation could connect the learners with the institute. And the principals, by their online teaching learning, the integrity, equity, inclusiveness, fairness, ethics, safety, and considering the regionality was a very important things which can be recommended for all online teaching all over the world as well, I think. Thank you, Professor Majumdar, was the mentor at my lecturership when I joined at my Center for Medication. I miss you, Professor Majumdar. Since then, you are my boss still now. Thank you very much. Then the next presentation, which was, you see, the COVID has given a new dimension in regards to the public health handling the disease patient, handling the dead body. Especially in the context of Bangladesh, the Infectious Disease Act, which was approved in the year 2018, helped a lot. So the study conducted by Nabonita Bonik, really a brilliant student, I think, was an eye-opening for the country, considering which should give the due importance in regards to the public health law. And again, the Jannatul Firdaus, you see, I have mentioned, when the demoralized student, depressed student was within the home, would not go to the medical schools, their online teaching opened the gateway for them to be connected to the institutes. So, but the studies, the other study by Uma, which was presented by Professor Majumdar, you see, the accessibility by the students, availability of the equipments, and lack of expert faculty members, internet connectivity, and the IT experts, and especially the important issue which should be the policy people, the curriculum planner should be think about. Within the normal curriculum, there should be an option or option B, when any disaster situation, the institute or the people can think for the teaching, learning, and assessment, as because the COVID-19 pandemic situation has opened the eye, and it should be as the plan B in the formal curriculum, how when a disaster situation occurred, how the institute can move forward with the formal curriculum. So I think, thank you all the 6 presenters and the professor, my co-chair, Professor Nazmul Islam, and also the moderator, Mr. Arun Shai. I think with these few words, I conclude my concluding remarks. Thanks all the 6 presenters, Professor Nazmul Islam, my co-chair, and also Dr. Arun Shai, the moderators. So I'm over. I hand over mic to Mr. Moderator, Mr. Dr. Arun Shai. Thank you very much.
Thank you, Professor Oman Kabir Talukdar sir. It was very insightful concluding remarks. But before, signing off, I would like to hear some concluding remarks from our another chair, Professor Nazmul Islam sir. Sir, you have to unmute, sir. Your mic, unmute.
Yeah, okay. Thank you, Arun. It was a wonderful evening. All the presenters, they turned out in time, and all the papers went on very well. And we have to think in a different way during this COVID new era and after the COVID. So we have to reshape our thinking, reshape strategy. We have to rethink about the curriculum, medical curriculum, particularly undergraduate courses. So this discussion will go on beyond this session. And I would like to express my heartfelt thanks to Arun, Professor Humayun, for your beautiful moderation, beautiful conclusion, Professor Humayun in particular, and some very known faces are here in this session. Professor Anuradhi Majumdar, he is like my elder brother. He is one of the most favorite persons in my life. I wish you all the best. Stay safe, and stay safe. Thank you very much. Thank you all. To you, Arun.
Yeah, thank you, sir. Thank you very much for your very deep and very inspiring insight. We really appreciate your valuable time, and we appreciate all the participants who did very hard work during this pandemic and showed up and presented in a very nice way. We really appreciate, and from the Public Health Foundation of Bangladesh, we are very thankful. Thank you, everyone. See you again. Good night. Yeah. Namaste.
Okay.
You are watching Raj TV, Jagorone, Bangladesh. Please subscribe our channel.
Thank you very much.